name is Linda Ehlers and I'm a chiropractic physician. The purpose of this video is to provide you with an explanation of how your acupuncture treatment to stop smoking will work. We'll discuss what acupuncture can do and what it cannot do when you use it as a means to stop smoking. Also, we'll discuss what you should expect from your treatment and what to do if something unexpected occurs.
If you look at this light switch, you'll see that it is in the on position. Even if you're not an electrician, you know that there are essentially two wires running from that switch to the lights in the ceiling. When the switch is in the on position, a contact is made between those wires. This contact allows current to flow through the wires and the bulbs come on. If you reach over and turn the switch into the off position, you'll move those two wires apart just a few millimeters. The current is unable to jump the gap that has been created, so the bulbs stop glowing.
When you and I started smoking, we wired into our nervous system a similar type of circuit. In effect, we physically forced our nervous system into a mechanical change. And this electrical change, this mechanical change, is now permanently in place and cannot be destroyed. It's a circuit that demands that we have nicotine at whatever interval suits our personal needs. And it's impossible for anyone to destroy that circuit. And if you're like me, you found that out each time you went back to smoking, after quitting, and then just having one.
The purpose of the acupuncture is to turn off the switch that controls the withdrawal circuit. It cannot destroy the electronics of the addiction. That will remain in place throughout your lifetime. But the acupuncture can minimize the withdrawal syndrome that we all know about. The withdrawal from cigarettes can be very difficult to experience. Both the research and our personal experiences have shown that people trying to quit smoking suffered from intense cravings, mood alterations of either depression, anger, or increased aggressiveness, excessive weight gain, stomach pains, headaches, nausea, dizziness, anxiety attacks, loss of concentration, insomnia, constipation, and many more. The purpose of your acupuncture treatment today is to minimize or eliminate these withdrawal symptoms and make it easy for you to quit smoking. This withdrawal switch will help explain the only odd side effect of this acupuncture. On some people, when we turn off this switch, it takes some time to settle into place. If that happens, people will call the office and describe having experienced sudden thoughts about having a cigarette that came and went quickly. Usually these will happen in moments we wouldn't ordinarily think about having a smoke. Locking the car and walking into the house, or drying yourself off after a shower. These quick thoughts about a cigarette we call flashes. What we believe is happening is that the two ends of the wires in the switch occasionally touch and allow quick surges of current to flow through the addiction circuit. If this happens to you, they are temporary and will stop as soon as the switch settles into place. When you want to quit smoking, the question isn't whether you can quit. In fact, there are really two questions. How hard will it be, and how long will you stay off the cigarettes?
The answer to the first question, how hard will it be to quit smoking, should be answered that it was easy with the help of your acupuncture treatment. Remember that the purpose of the acupuncture treatment is to turn off the withdrawal switch. The second question, how long will you stay off the drug nicotine, depends in part on how well you understand this light switch analogy. Remember, as we said before, the two wires in the switch are only pulled apart a short distance.
It doesn't take much nicotine to bridge that gap. One puff on one cigarette, one drag on a pipe or cigar, one piece of gum containing nicotine, one mouthful of chewing tobacco will put more than enough nicotine into your system to bridge the gap and start withdrawal feelings. Once that happens, and most of us have tried the just one won't hurt technique, you end up smoking again. As you can imagine, an electronic circuit gets set up in anyone who uses addictive drugs or has a genetic predisposition to alcoholism. You know that anyone who's gone through a detox program for these drugs can't have just one. They shut off withdrawal through sheer physical effort. You would never try to comfort a recovering alcoholic on a bad day by offering them a drink. This same thinking must now be applied to yourself, because if you pick up just one, you are in effect giving yourself permission to go out and buy a carton of cigarettes. After all, they're cheaper that way.
So you understand what the acupuncture is supposed to do and how it's supposed to do its job. But what if after your treatment you experience withdrawal symptoms and they're not easy to control?
Then you must call the office immediately. There are only two classes of withdrawal symptoms that could show up after your treatment. In the first case, we see basically the gastrointestinal symptoms like stomach problems or headaches. If they do occur, call us and we'll coach you on what to do. These are problems that are easy to correct, and you can fix them at home or at work. If they are the normal problems, you'll be okay in a matter of hours. The second class of symptoms are those that involve mood swings and anxiety attacks. If these occur, they are very unpleasant, and you must contact us immediately. You will not be able to correct these on your own. We have backup acupuncture treatments which will shut these off. We know that you realize that everyone is different. If you do experience any of these withdrawal problems, it means that you require a customized backup therapy.
What you've learned today is that using any type of addictive drug physically changes your nervous system and in effect creates an electronic circuit. Once that's happened, the only thing you can attempt to do is make it through the withdrawal and then never use the drug again.